What complications can occur in facelift surgery?
Facelift surgery is one of the most extensive procedures for facial rejuvenation, so naturally patients are concerned about complications. Complications can range from minor to health-threatening. I'll discuss the potential risks and complications associated with facelift surgery and how I perform facelift surgery for my patients in a way that has been safe and successful for decades. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. My pursuit for safety with facelift surgery began soon after my fellowship training, where I observed and participated in facelift surgery routinely performed under general anesthesia. These patients had drains and very large bandages and required overnight stay at a facility with skilled nursing monitoring for several days and even longer. Much of the justification for this type of aftercare was related to recovering from general anesthesia, which often is associated with people being nauseous or vomiting afterwards. Further, this would result in greater risk for bleeding and requiring emergent return to the operating room in order to drain a hematoma. As I did with eyelid surgery, I performed facelift surgery in my practice with local anesthesia and observed how well my patients felt immediately afterwards with no anesthesia-related complications. I performed all kinds of facelifts, from short scar to deep plane, face and neck lifts, with local anesthesia and light sedation, as I said, for decades thereafter to this day, and not needing to use general anesthesia. Safety with facelift surgery begins with patient selection. I see a lot of people who come in during consultation who lift their cheeks up and backwards and conclude that they need a facelift. I see this in people ranging from age 40 to 80s and older. For a lot of people under 60, the lifting of their cheeks is not necessarily related to laxity or loose skin, but rather bone and soft tissue loss. In contrast, a lot of people who are more likely to benefit from facelift surgery have sagging skin, jowls, and excess skin under the chin. I explained that facial aging involves two processes: bone loss and skin laxity. They both occur at the same time, but to a different degree depending on genetics and age. It's important to define the problem before you define the solution. For many people, the deflation of their facial definition is best addressed with a procedure we perform called structural volumizing. This technique is unique in that conventional hyaluronic acid fillers are placed in a specific way that parallels the techniques used for facial implant surgery. Unlike conventional filler placement, which leaves people looking soft and bloated, people who have structural volumizing appear well-defined and more youthful. In a way, they actually avoid facelift complications by not having a facelift at all. During a consultation, when I determined that a patient is a suitable candidate for facelift surgery, I reviewed their medical history, including their medications, and in particular, I'm concerned about any medications that are blood thinners. I asked them to be cleared by their doctors for a procedure that will take a few hours under local anesthesia with intravenous sedation. Fortunately, this approach is minimally stressful to the body in comparison to having the procedure under general anesthesia. When patients go under general anesthesia, they are simply at greater risk for complications, such as postoperative nausea and vomiting, as well as more serious medical complications related to the formation of blood clots, such as pulmonary embolism. We minimize these risks by using local anesthesia with IV sedation. Bleeding and infection are also risks that have to be appropriately managed so that the probability of these occurring are minimized. As I mentioned earlier, I look to see if there are any blood thinners on the patient's list of medications that they take. And I also want to be sure that their blood pressure is well managed, again, in order to minimize the risk of bleeding or hematoma. Infections, fortunately, are quite rare, and we use antibiotics prophylactically unless otherwise contraindicated. Undesirable cosmetic results, including problems such as poor healing, thickened scars, and pixie ear deformities, can also occur. I cannot overstate that this type of surgery is truly an art and that judgment is critical to minimize the risk of these types of issues occurring. Although well-executed surgery can still have problems related to how a patient heals, we try to use everything we can to minimize risk for the aforementioned issues. For example, one of the critical steps during facelift surgery is the trimming of the excess skin. This can be compared to being a good tailor and avoiding not taking too much skin so you don't induce excess tension that could potentially result in undesirable scarring. We also routinely use a material called extracellular matrix by ACell and PRP to further enhance the healing of the incisions. I'm pleased to say that this approach has been very successful for many years. Something that has come to my attention recently is that I'm seeing people who have had their procedures with well-known surgeons. Generally speaking, I would expect that the quality of work would be at a high level. Yet, these patients are coming in with complications I wouldn't have expected. These patients report that their consultation with the surgeon was only a few minutes and that they saw the surgeon very briefly on the day of surgery. In my mind, this doesn't make any sense, as it takes time to evaluate what a patient wants and what kind of procedure would be best suited for them. In my office, I personally take photos of my patients and then show those photos to them on the screen from multiple angles. And I have a discussion to what specifically applies to their situation and what my recommendations are for them. It's critical that people be educated so they understand what any procedure can and cannot do for them. On the day of surgery, I take photos again. I show the patients the markings that will be used for guidance during surgery. I have them review the photos of their markings, and they sign the photos, acknowledging that they understand what will be done. All of this takes time and minimizes the risks of any miscommunication. In medicine, as in everyday life, there is risk. We wear seatbelts when we drive and look both ways when we cross the street. If you're considering facelift surgery, consider what I've discussed as a way to help you reduce the risk of complications with facelift surgery when you're ready. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.